introduction. Hi, everyone. As you can imagine from the introduction, you will be hearing more of the Brazilian accent today in this talk. So I'm very happy to talk to you today about the work we've been doing that started as a CSIRO industry placement program. Sorry, I'm shorter than previous speakers. That we are doing with Angus Australia, and this industry placement program places an early career researcher with an industry partner with a need for R&D, and in this case was around breed PINKEYE resilient Angus. So we had a few questions. We wanted to understand the genetics behind PINKEYE resilience. We wanted to be able to generate research breeding values for PINKEYE resilience. And we wanted to explore the relationship between PINKEYE resilience and immune index. As you heard from Aaron's talk, we are doing great research around immune competence in cattle, but we don't know much about the relationship between specific diseases and immune index, so we are interested in that too. So we needed a plan to do that, and what I'm going to do today is to walk you through the different steps or stages of this plan, and until where we are now, which is what I really want to talk about. So the first thing we needed to do was to understand better the disease, understand the phenotype, so how to record it, and understand what was known about the genetics of PINKEYE. So PINKEYE is an umbrella term for a range of eye conditions. It can happen that a lot of diseases that cause redness in the eye and tearing might end up classified as PINKEYE, which is one of the challenges. But when we are talking about PINKEYE, we are really talking about an eye disease with clinical signs restricted to the eyes that is called infectious bovine keratoconjunctivitis, or IBK. It is a multifactorial disease. We will see more about that in the next slides, the component causes of the disease. But because it is such a multifactorial disease, it's really hard to prevent or to predict the next outbreak. But the good news is that we see differences in incidence and in severity between different herds, but also between animals within the same herd. So we can attempt to identify more resilient animals, but most important, the less resilient animals. It is a painful disease, so it's a serious welfare concern, but it also has financial implications. So it's estimated to affect 2.78% of the global cattle population, but this percentage is much higher here in Australia, just a little bit above 10%, causing Australian farmers to spend around $10 million a year just with the cost of medications for PINKEYE. It is also one of the diseases in the immune ready, like we saw yesterday. So I think I don't have to say too much more to convince you that it's an important thing to work on. So as I mentioned, there are different factors that contribute or cause the disease. Moraxella species of bacteria is supposed to be the main cause, but there are also other non-Moraxella organisms that have been associated with the disease. But we are still trying to understand how that works. So it might be the case that Moraxella is not exactly the cause of the disease, it's more of a secondary, like a consequence from other factors that happened before. And these factors include, for example, environmental factors that can irritate or cause lesions in the eyes. So bush fly is a big one. Pasture conditions, season, so summer, high UV incidence, exposure to dust, plant debris and pollen, wind, and so on. There are also a host associated factors. So there are breeds more prone to develop PINKEYE. As you might know, Angus and Hereford are more prone. Age groups, younger animals are more prone to develop the disease. But there are other things like differences in immune response, concurrent illness, body condition score, stress, and so on. There is also, of course, genetic factors, and if we look at the literature, we find heritabilities of around 0.1, which is quite low and reflect much of what we are talking about, having all these environmental effects having a big role on the disease, but also reflect the challenge that it is to record this phenotype. So for those who like numbers, here is a table extracted from a review paper that summarized a lot of studies around PINKEYE, and highlighted we can see the ones with Angus. And in the second column, we can see the different heritabilities that were found in these studies. So what we are, the important message here is what we are recording in these studies, and when we record PINKEYE in general, is not susceptibility or resistance to the disease. Because to do that, we would have to expose all the animals at the same time and the same intensity to the disease, and then see which ones got sick and which ones didn't. But that's not what happened. We have natural outbreaks, animals get in contact with the disease in different moments, so we have a very unsynchronized disease situation, which brings a lot of challenges. So for example, the time. When is the right time to record? Is it at weaning? Is it before? Is it through the whole animal's life? Is it even possible to do that? So we have to decide when to record the trait. There is also an issue of frequency. So if we record in a single point in time an animal that have no symptoms, is it because it is actually resistant to the disease, or maybe it just hasn't been exposed to the disease? Or maybe it had a really mild case of the disease and already recovered, and we are not capturing in a single point in time. So we need to measure a few times to get a good sense of what is happening within an outbreak. Which takes us to the next factor, which is how to score the disease. It can be as simple as a yes or no, or affected, not affected kind of thing, until very complex scores trying to record the severity of the disease. But again, with the score system, we have the same problem. If we are recording a single point in time, we might be recording an animal as a mild case, and then a few days later, it becomes a severe case. So again, we may be misclassifying the animals. Similar thing happened with treatment. So if we treat an animal that is a mild case, then it might not progress to a severe case where it would if it was not treated. So we really need to treat consistently within a contemporary group and record the treatment so we can take into account the fact that the animals were treated. All right, but this is a lot of literature review, a lot of research. We needed to understand what is happening in real life. So we wanted to understand your interest in PINKEYE, how big of a problem it was, and what are your perceptions about the effects of PINKEYE in your enterprise. So we ran this survey in the end of 2021, beginning of 2022. We got 238 answers, so if you participate on that survey, thank you. And I'll show very quickly some of the results of this survey. So we have answers from most of the states in Australia, just really showing how widespread is the disease. And most of our participants breed Angus only, but there are a smaller percentage that breed Angus and other taurine breeds too. When we ask, have you seen PINKEYE in your herd in the last 5 years, 97% of the participants said yes. And when we ask, how many years in the past 5 years, almost half of the participants said every year in the last 5 years. So quite relevant. When we ask what is the estimated percentage of your herd that is affected by PINKEYE, you can see we got a lot of different answers, but on average was around 5%. And when we ask how many of these animals, or the percentage of animals affected in both eyes, the percentage dropped to around 2. We ask how often do you check your cattle for PINKEYE, and most of the participants said weekly, so 45%, and 23% said when handling cattle. When we ask if you keep records of PINKEYE incidents, 96 participants said yes, which made us really happy. Data is always good. And we ask how this data was recorded, and most said as treatment details. When we ask what season, you mostly see PINKEYE, 68% said summer, so no surprises there. That's what the literature says too. And when we ask which age group was mostly affected, most of the answers were winners, and here really pointing that our participants had animals weaning from anywhere from 5 months old to 12 months old, so a bit of variability there. But also a lot of participants said younger animals, so between 2 months old until weaning, also affected. When we ask which of the following signs you associate with PINKEYE, sounds a bit complicated, but it's not. We can see the different signs on the left, and the answers could vary from always, often, sometimes, rarely, not at all, and no answer. So we can see that death and seeking shade is not very important, but the most common signs are increasing tearing, changing eye color, and lesions or scar in the eye. So yeah, we can use that as a reference for our phenotyping guide. When we ask what are the effects of PINKEYE in your enterprise, again, from the left to the right, high, moderate, low, none, and no answer, we see that there is not much effect in bull fertility or mismothering of calves, for example, but the biggest concern was around welfare, which is really nice to see. More important even than in the participants' perception than the economical part. But of course that came next, so decreased sale value of cattle and farm profits, and decreased weight gain and performance of affected cattle were the next two most important effects. When we ask if you treat PINKEYE, 41%, so most of the participants said always, and 22% said usually. So again, we really need to treat the animals consistently and record the information about treatment. When we ask if you do not treat PINKEYE, why not? Most of the participants said handling to apply treatment increase the risk of spreading the disease. So that's interesting, that's important, because we need to collect the phenotype in a way that fit management practice. So we don't want to try to solve a problem by creating a different problem. So we have to keep that in mind. All right, so with all this information in mind, we went on to propose a phenotyping guide, and then we had a focus group with some members to get some feedback and discuss the feasibility of the guide. So this is what we end up with. It's a system with 4 scores. So we have 1 for unaffected cattle, so no signs of PINKEYE. We have 2 for mild cases. So that's an active infection with tearing, redness, but no ulcers. We have number 3 for severe cases, so clearly severe there, with ulcers protruding from the eye. And then we have score 4 for animals that are healing, so that it's not an active infection anymore. There is no tearing, not much redness, but the animal was sick and now have a scar or a sign of the disease. Things to keep in mind about this scoring system is we need to score both eyes. So it's almost as it was 2 traits, so PINKEYE right and PINKEYE left. We need to record treatment information and treat consistently within contemporary groups. So I think I said enough about that. We also need to record our management groups and all the known genetic factors that could influence incidence of PINKEYE. We need full scores only, so just 1, 2, 3, or 4, no half scores. This trait can be set up in your herd record programs or first site data capture units as 2 different traits with score 1 to 4. And we are working on an Excel template to organize all of this information. What animal type and age or class we are aiming at? So these are Angus Australia registered calves, so HPR, APR, or ACR, or genotyped commercial Angus cows. So preferably animals that are genotyped, and a big focus on calves and weaners. But of course, all the information is relevant. So if you have information on bulls, steers, and heifers, that would be good too. About the phenotyping period and location, so as I said, it's important to measure several times so you can really have a sense of what is happening within the outbreak. Of course, it needs to fit management practice, so it needs to be feasible. So here are a few moments where it would be possible to record. consider from the first yarding event until up to 30 days after winning. So the first time could be when yarding dams for AI or bringing bulls in for natural joining. A second opportunity would be when yarding dams for the last AI event or bulls out of the natural joining, then at winning, and then 30 days after winning. But of course, the more you record, the better. Ideally, in an ideal case, you would record once a week for 5 consecutive weeks. That would cover 30 days of the outbreak. But of course, again, it needs to fit management practices. Preferably through the yard, so you can really score the eyes. All right, all of that was to get to this slide. It's a call to action because to answer the questions that we proposed here, we need data, and we don't have this data yet. So if you have historic data that fits all the things we were discussing here today, please get in contact with us. It would be great to have some data to start working on already. The survey indicates data is out there, so hopefully we get some data. But also we need to start collecting PINKEYE scores. So we are already starting to this year joining with the ASBP cooperator herds and some members, but we are expecting that for next year winning events, we will have the chance to collect much more data. We are aiming at 5,000 phenotyped and genotyped animals, so we can start our genetic analysis, start our R&D around that. So yeah, it's really up to the data now, what we are able to do. So yeah, please get in contact to us if you have data or if you want to start recording this data and want more information. You can get in contact with Christian or myself. And yeah, thank you for your time.